Hello, my name is Daniela Stan. I have been working as a midwife for 34 years and I am a director of care at Clinical Hospital Professor Dr. Panait Sârbu from Bucharest. I am also a PhD student, fourth year at University of Medicine and Pharmacy of Bucharest. Also, I am the initiator and project coordinator of Parent School at Professor Dr. Panait Sârbu. It gives me a great pleasure to present to you the project developed within the hospital where I carry out my activity. Today, I'm going to present to you the antenatal and perinatal care for women with gestational diabetes, a best practice implementation project. Since the project was registered as a quality improvement activity, there was no ethical approval required. This study is carried out by Clinical Hospital of Obstetrics and Gynecology Professor Dr. Panait Sârbu in collaboration with the Order of General Nurses, Midwives and Nurses Bucharest branch. The audit question that we are trying to respond is, are women with gestational diabetes care based on best practices? The first step in caring for a pregnant woman is screening for gestational diabetes, as it is one of the most common pathologies found in women with a BMI greater than 30. Also, the presence of gestational diabetes in the evolution of a pregnancy increases the risk of early complication in newborns. What this paper adds? The practice of midwives and nurses in the care of patients with gestational diabetes has been improved by following an educational program structured on the basis of the best evidence of good practice. Initiation by midwives and nurses of patient education program with gestational diabetes structured on the basis of best evidence of good practice, and the care plan performed by midwives and nurses of the patient with gestational diabetes is supplemented with recommendation obtained for interdisciplinary consultations, such as consultation of physiotherapists and other healthcare professionals. The aims are to implement in the clinical practice of nurses the recommendation of evidence-based practices regarding the care of women with gestational diabetes, in order to ensure patient safety and to improve quality of healthcare. The main objectives are to determine current compliance with evidence-based criteria regarding healthcare for women with gestational diabetes in the antenatal and intrapartum period, to improve knowledge regarding best practice regarding healthcare for women with gestational diabetes in the antenatal and intrapartum period, to improve outcomes regarding healthcare for women with gestational diabetes in the antenatal and intrapartum period, and also to identify barriers and facilitators to achieve compliance and to develop strategies to address areas of non-compliance. The methods that we used, there were three methods. The first one was to establishing a project team and undertaking a baseline audit. This method was formed by three phases. The first one was establishment of the team between the 1st and 28 February 2021, the baseline audit between 15 and 30 April 2021. The second phase was to design and implement of strategies to improve the practice. This phase took place between May to October 2021, and the last phase was the follow-up audit between 26 and 27 October 2021. The second method that we used was GBA framework, designing and implementing strategies to address non-compliance. This means reflecting on the results of the baseline audit and designing and implementing strategies to address non-compliance found in the baseline audit informed by the GBI framework, such as barriers, strategies, and resources. The third method was follow-up audit and identify future practice issue to be addressed in a subsequent audit. The aim was to assess whether there is an advance in compliance with best practice and identify areas where further improvements were required. The same audit criteria in sample methods will be used for the follow-up audit cycle, and the follow-up data will be entered to GBI piece and data analysis. Comparing follow-up results with those of baseline audit will be undertaken to examine any change in compliance rate. The methods that we used for data collection were evaluation of current practices by applying a semi-structured interview to midwives and nurses in the ward, checking records, and direct observation of completing a checklist during hospitalization in all women with gestational diabetes for observation of current care practices. During the study, there were midwives and nurses that participated. They were working in an obstetric clinic with responsibilities in caring for women with gestational diabetes, 30 women with gestational diabetes from hospitalization to discharge. And the study was conducted in obstetrics department with 57 beds. In the right side of the screen, you can see the results of the baseline audit. Unfortunately, I do not have enough time to go through all the results, but I'm going to share with you a couple of them. For the first criteria, which assess whether pregnant women are screened for gestational diabetes on admission to the ward, compliance with good practice recommendation was 100%. A maximum compliance rate can be observed in the case of the practice of daily self-monitoring of postprandial blood glucose level, and only 90% of analyzed cases, the glycemic level of pregnant woman is maintained in a normal range. The GBI framework that I mentioned earlier, on the left side of the screen, you can see the barriers, then the strategies that we use, and on the right side, we can see the results. The first barrier was the lack of knowledge about care of women with gestational diabetes in the antenatal period and intrapartum. The strategies that we use was educational, theoretical, and practical training, 15 hours, and the training objectives were to improve the knowledge of nurses and midwives regarding the specific care provided by midwives and nurses to patients with gestational diabetes, patient education on gestational diabetes self-management, and care plan for women with gestational diabetes in the antenatal period and intrapartum. The results was to improving the knowledge, attitudes, and practices of midwives and nurses regarding the care of women with gestational diabetes. The second barrier was the lack of evidence-based recommendation, protocols, or procedures, standard forms for the care of women with gestational diabetes. The strategy was to improve or to develop procedures and protocols in line with best practice recommendation, dissemination of protocols and procedures among midwives and nurses, and their implementation in the hospital intranet education. The result was implementing good practice in the process of caring for women with gestational diabetes. And the third barrier was inadequate patient education for gestational diabetes self-management. The strategies that we used was training midwives and nurses on patient involvement in gestational diabetes self-management and to develop a patient education guide. The result was involving patient in gestational diabetes self-management. Here on the left side of the screen, sorry, you can see the results of the follow-up audit. The follow-up audit was carried out between 25 and 27 October 2021 using the same audit criteria and sampling methods as in the basic audit. The figure on the left side, as I told you earlier, shows the compliance rates with best practice obtained in the follow-up audit compared to the results obtained in the basic audit. An essential role in implementing the practice change strategy was played by the team leader, the head nurse in the department. She prioritized the change process and managed to support the entire team of nurses and midwives, cooperate and be actively involved in stages of project implementation, patient education to provide additional advice on nutrition therapy, physical activity, and blood glucose monitoring are critical steps in preventing and managing gestational diabetes. And another important stage of the implementation plan was patient education. The baseline audit found found that only 63% of patients reported exercising at least twice a week. In conclusion, the prevention and management of care in the gestational diabetes is essential for the health of the mother and the child. The project translated into clinical practice of midwives and nurses in the recommendation of good practice regarding the care of the patient with gestational diabetes. And the results of the initial audit highlighted the need for early intervention in educating the patient about the prevention and self-management of gestational diabetes. And in the future, it is necessary to resume the activities of audit practices in order to assess the sustainability over time of the measure implemented. The authors would like to thank the GBI team for their support and training, as well as the team of hospital professionals who participated in the study and supported the smooth running of the project. I would like to thank you very much, and I hope you will all have a great day. Thank you.